Okay, so let's unpack this. We're doing a deep dive into something really important today. How you can get the most accurate information about a pregnancy and get it fast, specifically here in the UK.
Right. And for this, we're looking at sources from Blood Test UK.
Exactly. Our mission is to show you why getting a blood test early is such a smart move and, why the NHS system is so key to making it work.
So let's start with the basics. What even is a pregnancy blood test?
Good question.
It's a simple medical check. You get it done at your GP surgery, and it looks for a very specific hormone in your blood.
That's the HCG, right? The human chorionic gonadotropin.
That's the one. And here's the crucial part. The sample doesn't stay there. It gets sent to a proper NHS laboratory.
And this is where it gets really interesting because this isn't like a home kit. It's not just a yes or no answer.
No, not at all. It's quantitative.
Meaning it gives you an actual number. It measures the exact amount of HCG in your system.
Exactly. And that number is everything. It tells a story.
A story. How so?
Well, because doctors can see the precise level, they can do so much more than just confirm you're pregnant. They track how that number changes over time.
Okay.
If it's too low, or if it isn't rising like it should be, that's an immediate red flag.
A red flag for what kind of thing?
It could signal potential complications. Things like an ectopic pregnancy, or even a possible miscarriage. It allows the care team to step in right away.
Which leads right into the first huge benefit then, quick access to care.
Absolutely. The test is processed through the NHS, so that result goes straight into your health record.
So there's no delay, it's an integrated system.
Right. You get immediate access to NHS prenatal care and all the support services.
Yeah.
You are, officially on that monitored care pathway from day one.
And I imagine that connects to the second benefit, just peace of mind.
A huge one. The anxiety of not knowing or only sort of knowing is immense. This just cuts through all that worry.
You go from wondering to knowing, and then straight into planning.
Yes, and you start with a really solid health baseline, which is so important.
So if it's this accurate, timing must be pretty important. When should you actually get tested?
That's a great question. The guidance from places like Blood Test UK is pretty clear on this.
And what's the advice?
Generally, the sweet spot is about 7 to 10 days after a missed period.
Okay, 7 to 10 days. Why then?
It just gives the HCG levels enough time to build up so you get a really reliable result. But, if your cycle is irregular, you have to talk to your GP.
Right, they can give you that personalized advice.
Definitely. And I should add, for women over 35, the sources really recommend getting tested as soon as you even suspect a pregnancy.
To establish that baseline as early as possible.
Exactly. To get ahead of any potential issues right from the start.
Okay, but let me play devil's advocate for a second.
Go for it.
I can go to the chemist, buy a home kit, and get an answer in 5 minutes? Why would I book a GP appointment and wait for lab results?
It's a fair point. And it really gets to the core of this deep dive. Home kits are incredibly convenient, but they're qualitative. They just shout yes or no. They don't give you that number, that powerful diagnostic number.
And the number is what allows for the surveillance, the monitoring.
Precisely. For anyone with risk factors or just an irregular cycle, the precision from an NHS lab test isn't just nice to have, it's an essential tool for protecting the health of both mother and baby.
So when you put it all together, what does this all really mean for someone listening?
It means that getting a pregnancy blood test early here in the UK, following your GP and NHS guidelines, is really a key part of preventative health care.
It's about using the system to get the right information at the right time.
That's it in a nutshell.
So a final thought for you to chew on. If this kind of early detection gives you rapid access to care for things like ectopic pregnancies, what other health checks could you maybe coordinate with this first blood test to streamline your entire health journey from the very beginning?
That's a great question. And if you want to find out more, a lot of the source of information we use for this deep dive is right there on the Blood Test UK website. We really encourage you to check it out.